Yes, our viewers, you're most welcome. Thank you for viewing. Thank you for subscribing. Thank you for your comment. Thank you for the likes. Yes, let me hope that whenever you sit down and watch our videos, you get something and you don't remain the same, right? If it is so, thank you very much. And if you watch and then you don't get something, you're not picking up something, please, I would like also to get a comment from you. Okay. Yes. Today we are going to look at loose stool or diarrhea in children. Okay. Yes, some causes of diarrhea in children are same causes of diarrhea in adults. Okay, so some of the medicines or the drugs that we shall talk about in this particular video can as well be used by adults. Okay, yes. There are causes of diarrhea in children. Okay, and most of the causes of diarrhea in children is due to bacterial infection, and this is because at times these children eat from the ground. If you bought for him something or is eating something and it falls down, at times they pick it and eat it. Then they are also fond of eating soil. When you put a child to play, you find him eating dirty things. So this makes them prone to bacterial caused diarrhea. Okay, and diarrhea is something that can cause you should worry about, and at the same time at times you could not worry about it. Okay, depending on how it has presented, okay, how it has come in. Okay, because in certain cases diarrhea will come in with fever. In certain cases diarrhea will come with too much pain, abdominal pain. In certain cases diarrhea will be just there. Someone has diarrhea but he has no pain, he has no fever, and he's not vomiting. So all this, okay, but every after some time you see pew pew pew, he keeps diureting, or the kid keeps diureting. So it depends. Like I told you, we at times need to worry about diarrhea, and at times we don't need to worry about diarrhea, depending on how it is presenting. Okay, then we've had one cause being a bacterial cause, and another cause is a physiological cause. Physiological, that the body fails to absorb adequate amount of fluids from what you've eaten, what you've drank, and then when it fails to absorb enough of it, excess is lost in the stool. Okay, excess can be lost in the stool. That is due to physiological cause. Okay, and such kind of diarrhea will not bring any fever. Such kind of diarrhea will not bring any pain in the abdomen, and such kind of diarrhea is not that frequent. Okay, is not that frequent. Like somebody can pass the stool once, then maybe after 12 hours or another day again he passes that stool, but there is no pain. uh, the the smell is normal. Okay, right. And then we also have in children more so, at times they present a physiological diarrhea in them is also there. You'll find a kid will pass, is like most of these ones who are still breastfeeding, they will pass the kind of yellowish yellowish gray stool, okay, and the smell is okay, is watery, but the smell is okay. So that kind of diarrhea in children, you don't need to worry much about it, but you need to take a step to ensure that you control that diarrhea. Okay. Yes, we have uh, the ORS or DAROs, and we have the zinc tablets. Right, it's true, they are good and we use them, but they should not only be used. Okay, you can use the two, and you need to add something more on top of the zinc, on top of the ORS. Okay, so in diarrhea that is caused by bacterial infection, definitely we shall need antibiotics. Right, we shall need antibiotics for that bacteria, for that kind of bacteria diarrhea, or that kind of loose stool. Right, and we shall also need what we call antispasmodics. Antispasmodics, these are drugs that help the body to rehydrate or to normalize the metabolic movement of the GIT. Okay, the movement of the GIT, because it keeps pumping and pushing down, pushing down, pushing down. So the peristaltic movement of the GIT, when you take the antispasmodics, it helps to normalize that rate, and you will have some much time, and the food the food will spend some time in the GIT. It will move normally, and the intestines, the villi, will get the time to absorb the water, and you will pass normal stools. Okay, right. So now we need to look at the drugs of choice in diarrhea. Okay, one, we are not ruling out the zinc and the ORS. Reason being, why do we use zinc? Why do you use ORS? ORS or zinc is just a replacement, because in diarrhea you're losing the minerals, you're losing the salts from your body. So you take the ORS to what would I say? How would I term it? But it's just to fill in back what you lose in the diarrhea. So the zinc, we're also losing the electrolytes. So we need the zinc to replace what we are losing. All right. So zinc and ORS is just to replace what you're losing, but they do not stop the loss. Okay. Yes. Then sometimes you've heard people saying that you don't need to stop diarrhea. No, it's not right. Okay, it's not right to stop diarrhea. You can stop diarrhea. Okay, you can control diarrhea. Okay, so the drugs that we can use more so in children. One, if a child is passing a stool, or the diarrhea of this kid is having a foul smell, is having blood stain, then it is mucoid. There's some mucus stuff in it. This is a bacterial diarrhea, and this bacterial diarrhea will need antibiotic on top of other medicines that we are going to see. Okay, so this kind of bacterial diarrhea, mostly we shall need metronidazole syrup or metronidazole tabs. Then we shall need a tablet capsules called Atinol, or is a syrup also. There is a form of a syrup also called Atinol. So Atinol and metronidazole will help you very, very, very much or you can use Atino and chloramphenicol, the so-called calf syrups. They will help you very, very much in that kind of diarrhea in children where we have blood stain, we have the mucoid stuff of it, there is fever. And in that kind of fever and diarrhea, you'll find always your child lying on the on the stomach, okay, because there is pain. So he cuddles down and he lies like a rabbit. So when you find your kid lying like a rabbit and he has diarrhea, is definitely suffering of abdominal pain, and you need to take action by getting antibacterial syrup and getting Atino syrup, right? Yes. In children, more so less than 2 years, you give 2.5 mils of the Atino, 2.5 mils of the what? Of the metro syrup, and this is given 8 hourly. Okay, yes, we give it 8 hourly, and the kid will recover very so quick from the diarrhea. All right, so on top of giving the ORS, you'll need to add this. Okay, then there is diarrhea where there is no fever, right? Where there is no abdominal pain. You find a kid playing normally, but then when he passes stool, is having that. Okay, so that kind of diarrhea, you can use Atino only, because it is just going to help improve the rehydration, the reabsorption of water from the GIT, and then the diarrhea will be controlled eventually. Okay, but in case there is fever in that diarrhea, you need to have an antibiotic to be added onto Atino. Then we have also tablets called Diastop. Right, Diastop, we can use it, but normally we give it to children of 5 plus. 5 plus, you can give Diastop. 5, you can give 1 tablet, you can give a half tablet, depending on the duration. And then one thing I've forgotten to tell you at the beginning of this, the duration, okay, the duration of diarrhea, like the frequency. Okay, the frequency of the diarrhea matters a lot. If somebody is passing diarrhea frequently, that one we shall need to give this medicine as soon as we can. Okay, as soon as we can, give the Atino syrup, give the Atino capsule, give the metronidazole syrup, give the metro tablet, give the cough syrup, or give the capsules if you have, but not all the cough and metro. No, you can give cough or metro plus Atino. You can give cough or metro plus Diastop, right? Yes. Then allow me involve or increase, cover a little bit of this in adult. Yes, we shall have loperamide coming in. Loperamide is generally for adults 12 years plus. You can give them loperamide, that's 1 times 2 or 2 times 2, depending on how frequent is the diarrhea. Okay, then for the pain, normally we can give a little painkiller, that's paracetamol, and then your kid tomorrow will give you a big hug with a big smile, and diarrhea will not be anymore a problem. If you follow this idea or advice, we shall move well, and we shall save our nation, save our generation, and save our country. Okay, so with diarrhea, let's take note of this. When you are complaining of diarrhea, or when your child has diarrhea, take note of the following: how smelly is the diarrhea. What is this? Is it having a foul smell? Is it normal smell? Then look into that diarrhea. Okay, look into that diarrhea. Okay, and try to identify, is there any other maybe worms in it? Is there any blood stain in it? Is there any mucus in it? Okay, all these will help you to explain the situation to a medic, and you will get the rightful treatment. Okay, yeah, it's not right when you go to somebody and then you say you have diarrhea and then anything is given. Yes, so don't forget about that. Always remember to note the color, remember to note the nature, remember to note the smell of the diarrhea in children. It will help us to get the rightful medication that will help us treat the kid or an adult very well, and you will get a quick recovery, and you will not lose too much of the nutrients from your body, because you remember, building an element in the body in you is very hard, but losing it is very simple. And that is life always. Losing is easy and acquiring is difficult. So with that, thank you all viewers, and let me hope that you've gotten something about this. Okay, you've gotten something about this. Yes. Thank you very much for viewing, and thank you for subscribing. Enjoy and continue with your support. Thank you very much, and have a best of your day. Thank you.